demonstrate the application of an ulnar gutter splint. This would be appropriate for fractures of the shaft of the ulna, possibly if you wanted to extend it to incorporate the fingers. I have an assistant hold the patient's arm. We're going to keep the forearm in approximately neutral while we do this. I'm going to start with cast padding at the wrist. And I make sure I have at least 2 layers of cast padding everywhere, but over a prominence like the ulnar head, I'm going to make sure that I have 3 to 4. I tear the cast padding as I come around the corner to make sure that it's not tight and also to make sure that it doesn't bunch. So I want that to lay down nice and flat against the patient's skin. I'm not creating any wrinkles. I'm going to bring this up the forearm to the elbow. And when I get to the top, I'm going to put 2 layers of cast padding right on top of each other. So that's my padding. I'm then going to take the splint. We're going to cut this one down just a little bit. When we cut our splints, we want to make sure that we don't have any sharp edges exposed. So after I cut to length, I will take and remove about 1 centimeter of cast material so that it overlaps like that. And here we want to make sure, if we're just doing this for the hand, we never want to immobilize a portion of the body we don't need to. And so your palm, you actually bend your fingers at your mid-palmar crease right here. So I don't want to go past that mid-palmar crease. So I'm going to kind of look at my patient, make sure that I'm there at the mid-palmar crease, and then I can run that down the ulnar gutter. And I'm making sure my cast is nice and smooth, the splint's nice and smooth. I'll start wrapping at the wrist, and I'll come around. And would you mind handing me those scissors? And I don't want to come through the fingers with my ace wrap, because when I do that, I create a big wad of ace wrap there, and that creates pressure sores. So as I come around the thumb, I'm going to take, and I can either cut the material or cut a thumb hole out. That's a little generous cut, but I'm going to cut it so that it doesn't bunch. And you notice as I'm putting on the ace wrap, I'm rolling the ace wrap. I'm not stretching it. I'm never letting it leave the patient's body. I'm keeping the ace wrap on and I'm unrolling that as I go. And that ensures that I'm not putting too much tension on the limb. Remember, the limb that you're splinting, if it's injured, it's going to swell a little bit more. And we want to make sure that ace wrap has room to expand. So that's how you'd apply an ulnar gutter splint.